So I'm really excited to be presenting our data on Regeneron 5458 at this year's EHA. Regeneron 5458 is a BCMA CD3 bispecific antibody. Current study is looking at patients with more heavily relapsed and refractory disease. Patients had a median of 5 lines of prior therapy, ranging from 2 to 17 prior lines. The drug is intravenous, given in a double step-up dose fashion. So week 1, they get 5 milligrams. Week 2, they get 25 milligrams. And then third week and beyond, they get the cohort dosing. And once we get to week 16, we go to every other week dosing. Overall, the drug has had pretty impressive results. If we look at the entire dosing cohort, the overall response rate is around 51%. But if we look at those dosed with the higher dosing ranges, 200 to 800 milligrams, there was a 75% overall response rate. And of those responders, we saw a 43% rate of CR or better. So in the kind of full dose strengths of the drug, we're seeing very impressive response rates in highly refractory patients. Now, you can't talk about T-cell engagers these days without talking about the side effects, the two most notable being CRS and ICANS. So ICANS that we see a little more commonly in CAR-T, we saw very little. In fact, there was a little bit of grade 1 and 2. There were no grade 3 and higher ICANS in the entire study. And regarding CRS, the rates of CRS overall did not differ between doses. So whether or not you got low dose, medium dose, high dose, the rates of CRS are pretty standard, around 35 to 40%. It's all grade 1, grade 2. There was no grade 3 or higher CRS in any of the patients studied in this trial to date. So far we have a pretty efficacious drug with a really impressive toxicity profile. And at least in the US, where we have so many patients treated in the community, we're excited about the potential portability of a drug like this into a community setting.